Depression is a very common disorder. It's one of the most common disorders we know about. It can be a debilitating form of mental disorders for many people, and it causes currently the biggest burden worldwide. It is always a combination of a genetic liability with environmental impact on people. Life circumstances do impact heavily on people developing a depression. Depression comprises a whole array of symptoms, not only being sad, but it's also lack of energy, disturbed sleep, gain or loss of weight, poor concentration, and many other symptoms. So the most prominent for people usually is the mood, which is affected, but again, there might be other prominent symptoms which really impair the lives of the people. People do feel sad, but it is a little bit a different kind of sadness we all know, experience. Another very common form, which is highly correlated with depression, is anxiety. Most of the people also experience some kind of anxiety. Also, again, anxiety is something we all know, and it's good that we know something like anxiety, but because we are careful with situations, being anxious is a useful tool in the evolution of mankind. But naturally, the anxiety, these people during a depression experience exceeds most of what we know, what kind of anxiety we know. And this is the same with the other mood disturbances like sadness. It is mostly a different kind of sadness. It's not being able to feel anything, having also experiencing somatic symptoms. Many people complain having something like a stone on their chest, something like this, but various kind of pains, gastrointestinal problems, many others symptoms indeed are associated with depression. It is difficult to describe the causes of depression in one sentence. It is, like all mental disorders, it is a combination of some kind of genetic liability. It has to do with your personal development, with your personality, and there are environmental factors which can very heavily result in depression. For example, work can be such a contributing factor, but there are others as well, like difficulties in partnership. There might be many others reasons which contribute to the onset of depression. Depression affects quite heavily people's daily life. As I said, it does not only affect your mood, it affects your ability to concentrate, it affects your sleep. Either you feel tired or you can't go to sleep. Quite a few people develop some kind of suicidal ideation because life seems to be so grey and not worth living. So this is something we always have to have an eye on, naturally, to help people, to assist people to overcome depression. Because once you are in a depression, it seems that you never come out of a depression. But there are many ways and treatments to come out of depression. So what we use, it is a holistic approach, combined psychotherapy with medication and bioar, exercise. These all facets of a holistic treatment we offer to our clients. We rely on medication if necessary, but we don't rely on medication if not necessary. And this is what many people with depression experience, that they are prescribed medication which has serious side effects for those people, and the advantages of a medication must be very clear to the people and to us as well to use medication. So in the foreground, we treat psychotherapy for most of our depressive clients. This is a difficult to answer question if we can cure depression. As we have some kind of genetic liability for various forms of mental disorders, this is nothing we can change. But what we can help people is to develop coping skills, to deal with mental problems in advance, in the prevention, in the relapse prevention, etc. So you also must be aware that most mental disorders, up to 75%, have an onset between the age of 25. So you must be aware that it affects a long time of your life. It's not like a disorder of the old age or something like that. It's something you must be aware, something you might have to deal with during all your life. And it's not only important to treat the acute phase, in this case of a depression, it's also clear that you have to prevent further relapses. Well, we always start here with a 4 to 8 week treatment in our practice, and we offer continuous care to our clients, in particular because they always have a certain risk to relapse. So we keep contact, either psychotherapeutic contact, we do counseling, etc. But what we always try to do is to prolong the intervals. Our final goal always is that a client can lead his or own life without help. That's what we are always aiming for in our treatment.